Our next speaker today is Hannah Carey. Throughout the quarter, we have heard her speak on the topics of gun control and her outstanding dance coach. We've also learned that she hates spiders and that she won the highest kicker award. She first became interested in fetal alcohol syndrome when she took child psych class. Ladies and gentlemen, please welcome Hannah Carey.
Take a moment and imagine all the bad decisions you've ever made. Soon after realizing it was bad, hopefully you've moved on. Now imagine having someone else make a decision for you in which you have no control over, that will last with you for the rest of your life. This is what life is like for children living with fetal alcohol syndrome. Fetal alcohol syndrome, also known as FAS, is a mental and physical problem that may occur in a baby when a mother drinks alcohol during pregnancy. Over the next few minutes, we will be exploring what life is like for these children suffering with FAS. FAS is a condition that results from alcohol exposure during pregnancy. According to the Mayo Clinic online journal, copyright 2013, there is no amount of alcohol that is known to be safe to consume during pregnancy. If you do drink during pregnancy, you place your baby at risk of FAS. FAS is both a mental and physical disorder. FAS is caused by amount of consumption of wine, beer, or liquor. Copyright 2013, as stated by Kids Health, an online journal for kids and about kids. Yet many pregnant women do drink alcohol. It's estimated that each year in the U.S., 1 in every 750 infants is born with a pattern of physical, developmental, and functional problems referred to as FAS. As shown in the picture, when the mother drinks alcohol, it goes through the placenta, and that's how it gets into the baby, and it gets in the baby's tissues, and then that's what's called FAS, and they're born with FAS. Now that you know what FAS is, there's an immense amount of symptoms from FAS. Stated by Mayo Clinic, copyright 2013, the severity of mental problems varies, with some children experiencing them far greater degree than others. Growth defects in children with FAS may include many of the following abnormalities: low birth weight, small size for age and weight and length, small head, or failure to thrive. More symptoms from FAS include many behavioral characteristics. As stated by the Texas Adoption Resource Exchange, an online adoption center that knows about children's diseases, copyright 2013, children with FAS often have behavioral problems due to brain injury. Some are so severely affected that they cannot function independently in the community. Stated by Medline Plus, copyright March 22nd, 2013, almost none of these babies have normal brain development. Behavioral problems include developmental delays, attention deficit, poor organization skills, problems with memory, poor school skills, and much more. Reported by Science Daily, an online disease journal, copyright 2013, particular kids with FAS have attention deficit hyperactivity disorder, also known as ADHD. Often children with FAS are initially diagnosed with ADHD. Although FAS isn't necessarily treatable, there are many things you can do to reduce the severity of a particular child's case. Copyright 2012, an online website, Maternal Substance Abuse and Child Development. Children with FAS are similar to children with learning disabilities. They must be treated like them. Children with FAS are all about having structure in their daily lives, redirecting behavior, and not becoming overstimulated. While more and more mothers are drinking during pregnancy, it's important to know what FAS is, what happens when you have FAS, and how you can possibly treat it. As you can see, there comes no good from drinking alcohol during pregnancy. Make sure you know about how FAS can affect babies, because one day you or your loved one could be making a decision that will last with you and your baby for the rest of your life.